All right, welcome everyone. Good afternoon. I hope y'all are having a good day. It's a gray day here where I am in Kernersville, North Carolina at my house. So I hope you guys are cozied up or that you're in the office and being really productive. And I hope you're all safe and well. Thank you so much for joining us today. Since it's 1 o'clock, I'm going to go ahead and get started on some of our introduction information, and you all can get settled and comfortable while I'm doing that. So thank you for joining today's webinar, Recycling Resilience, MRF and Collection Safety During COVID-19. This webinar is being brought to you, if you can go to the next slide, Marissa. It's being brought to you in partnership with the Carolina Recycling Association, the South Carolina DHEC, North Carolina DEACS, and Renew by RRS. For those of you who aren't familiar with Renew, it is a new initiative that's connecting industry-led investments and community decision makers to improve recycling systems and build circular economies. So we like that. For more information on Renew, you can visit their website at www.renew/recycling.org. renew-recycling.org. I'd like to take a moment to thank our wonderful CRA sponsors who help us have events like this year-round. We could not do what we do without you all. So thank you so much. And everyone, please take a look at this list and see who is supporting recycling in the Carolinas and waste reduction in the Carolinas. All right, let's move on to our agenda. Quick overview of our agenda for you guys. So I really want to go over the purpose of this webinar first and sort of how it came to be. Our intention in offering it is to be really the first in a series of resilience-focused webinars or online forums so that we can discuss in real time the issues that we're facing as an industry related to this pandemic. So there will be opportunities for feedback at the end of this webinar and with a post-event survey that we will email out after this, where you can share with us the additional topics that you would like us to cover on these webinars. We think all of us in partnership on this webinar think that it is so important to keep communicating with each other about what's going on, and that is our intention. But today we wanted to hit the ground running and focus on what we, and our partners view as the top concern in our industry right now, which is health and safety during COVID-19. There have been a lot of webinars lately about COVID impacts and markets and, viewing recycling as an essential service, which we 100% agree with. But we noticed that in many of these webinars, there were some key questions that were being asked about health that have really been outside of our knowledge base with limited resources on this. And so, we feel the need to ask ourselves, what is the actual risk of our activities as they relate to the spread and the prevention of spreading coronavirus? How can we continue to provide waste recycling and diversion programs in a safe way that minimizes or eliminates risk ideally? Are we doing all that we can do, and is it truly effective? And lastly, are we communicating to each other and to the public well? And so we have brought to the table a group of leaders and experts in the field, including a public health expert, to try and answer as many questions as we can for you and for all of us. So first we will have our state overview with Sandy and Alex from North Carolina and South Carolina respectively. And then we will go into our collection safety panel. Now we are going to deal with recycling collection and other waste diversion collection programs. And we can certainly talk about and take questions about any kind of waste collection, whether it's solid waste, landfill bound waste, yard waste, electronics, whatever it is. It all extrapolates to other sectors of what we do. So it's all open. And then after that, we will go into our MRF Safety panel second. And if we have time at the end, we will take more questions and answers from the audience. So after our good friend Marissa Segundo from RRS gives us some housekeeping info and walks us through the interactive components of this webinar, which are really fun. I think you're going to enjoy the interaction that we're going to provide thanks to RRS helping us with that. We will go into the rest of the agenda. So I'd like to turn it over to Marissa now with RRS. The mic is yours, Marissa.
Great, thanks, Mary, and thank you all so much for joining. We're really excited about this opportunity, as Mary said. So just a couple of housekeeping items. You'll notice that you all are muted, and we don't want that to curtail your voice. So we do want your question and answer. You'll see a little black bar either on the top or bottom of your screen, and it has a little box that says Q&A. Go ahead and press that, and that'll open up a question box where you can, at any time throughout this presentation, add your questions for the speakers. There'll be 2 different question times divided, as you saw on the agenda, in those 2 pieces. And we look forward to answering your questions. Also, if you have any technical questions or issues, you can put those in there and we'll answer those offline. We will also be providing a recording of this webinar early next week on either the Renew website or CRA's website. So look out for that as well. As Mary mentioned, we like to do interactive polls and have done this pretty effectively in these type of settings. So you can answer in 2 ways. I'm going to actually show this one that this shows your entire screen. So since we're mainly on a computer, you can do the easy thing, which is to go to pollev.com/recycle123 to answer, or you can just grab your phone. And you see our sample phone here. You're going to send a text message to the number 37607. And what you're going to text is the combined word recycle123. This is not cap sensitive, and it needs to be one word, recycle123, and press send. Basically, that's just going to open the door to the poll. And it'll say that it's not ready yet, but in about 30 seconds or less, when we go to this next panel, you will see that that allows you to be in the poll. So as people are getting in there, I'm going to go through our first poll question. And this is in the form of a word cloud. So I'm going to ask you, using one word, or if you have to use 2 words, you can use in like a underscore or a hyphen. But in one word, what is keeping you going during this challenging time? We're seeing some responses come in: community, passion, people, hope. We need some hope. And as more people put in this a similar word, you're seeing our cloud grow, and we're seeing things like connections, faith, paycheck, snacks. Those are good too. Friends, and we'll give about 5 or more seconds. Hope is still winning. Passion is getting bigger, and faith is getting bigger. Community, economy, love, I like that one. The environment, it's the post-Earth Day, so that's a good one. Community is still getting big, and we're seeing markets and work. So thank you all so much for responding. We'll wrap this one up. I think hope gets to be the winner. Oh, nope, community won. Good job, community. And just to let everyone know, we have 88 people on the call right now, so we're hearing from a lot of different places. So I'm going to switch to a multiple choice question. And this one, you're just going to answer either A, B, C, or D. And the question is, have your operations or collections been disrupted by the pandemic? And if so, what's the, majority of the way? So have you reduced collection services, suspended yard waste, suspended bulk collection, suspended collection of recyclables, or no change, just business as usual, finding homes for our recyclables, hopefully using PPE. All right, so it looks like no change is the clear winner here, followed by suspended yard waste and reduced collection services. So this is good to see where we're at. All right, so now I am going to hand the mic over to Sandy and Alex for an update.
Okay, let's go. Sandy, if you could please tell us about what is going on from your the state level perspective in North Carolina. How are you doing? How is DEACS doing? How are y'all dealing with this? What is the recycling picture like in North Carolina right now?
All right, yeah, thanks, Mary. So I'll keep my update kind of big picture about how we've seen COVID-19 impacting recycling in North Carolina, and then I'll let some of our panelists dive into the details about safety. So in North Carolina, Governor Cooper declared a state of emergency on March 10th, and then on March 30th issued the statewide stay-at-home order that runs through April 29th. And in that order, recycling was specifically called out as an essential service to remain in effect. So, you know, during this pandemic, we're really being reminded of how essential recycling is as a feedstock to manufacturers. Many of the products that are in really high demand right now rely on recycling as part of their supply chain. So things like toilet paper, paper towels, the rolls that both of those come on, cardboard boxes for e-commerce and home deliveries, packaging, you know, glass, plastic, paper, metal packaging for food, cleaning supplies, and medical supplies. And since we have a lot of commercial and industrial facilities that are shut down right now, and we know those are big generators of recyclable material, it's even more important that we're still capturing the recyclables that are coming from the residential sector. And just as another reminder, you know, we still have our statewide landfill ban on aluminum cans and plastic bottles. So to our knowledge, all of the MRFs in North Carolina are currently operating. So we're not aware of regions that have lost a market for recycling processing. We know of a very small handful of communities, only 2 for sure, that have temporarily suspended recycling pickup. But overall, we think the impacts so far have been pretty minimal. You know, we recognize that the residential recycling stream is different right now. Since everyone's spending more time at home, they're generating a lot more stuff. So in order to prioritize the management of municipal solid waste and recycling, we've seen many communities adjust the scope of their services and temporarily suspend certain curbside collections, like bulky items, yard waste, and electronics. We've also seen drop-off sites limit some of their services, close things like swap shops, waive some of their residential fees to avoid money transfer, asking residents to limit trips, all in an effort to keep both their employees and the public as safe as possible. So we've seen some really good communication from our local governments about these service changes. And, you know, when you're reaching out to residents with updates, it's also a really good time to remind them what belongs in the recycling bin, because we know that the residential recycling stream is typically the most contaminated. So I'm going to ask everybody on the call to do one thing, and that is to please make sure that your customers can go to your website and easily find a list, preferably with pictures, of what's accepted in your recycling program. If you need any help with that, please contact us. You know, we have all of our materials from the Recycle Right and See campaign still available. We've got accepted lists tailored to each MRF in North Carolina, so we can quickly send you a simple graphic to use and post. And just a couple other things we're working on at the state. We have some social media posts coming specific to virus-related stuff, like gloves, masks, cleaning wipes, just a really simple message that these things belong in the trash and not the recycling bin. So we hope to share those with you soon. We've also got some materials in the works about composting, including a guide to backyard composting, which could be very relevant right now if you're asking residents to hold on to their yard waste for the time being. So that's it from me. I'll just end with a huge thank you to everyone on the call and their employees for continuing to show up to work and keeping our recycling programs going. So I'll turn it back to you, Mary.
Thank you so much, Sandy. That's great. And there's a couple questions coming in, so we will get to those after we hear from Alex in case they relate to both of you. So Alex is a local government liaison with South Carolina DHEC. And Alex, why don't you give us a quick update about what's going on in South Carolina, please?
Okay, great. Hi, everyone. So I've been in contact, or trying to keep contact with all the local governments within South Carolina. They've gotten many emails from me week after week, and just kind of seeing their operations and if there are any disruptions in their operations. For the majority of programs, they're taking the proper precautions that the CDC recommends: social distancing, the proper PPE, frequent hand washing, which is great. We've only had, from my knowledge, we've only had a couple of programs that have suspended recycling, the curbside recycling, in an effort to focus on trash, which is their main concern right now. A couple have also, similar to North Carolina, suspended bulk item pickup, either suspended or delayed yard waste pickup. And then on our drop-off side of things, some programs have suspended collection of certain materials that reports have come out about the virus living on it longer. So they're trying to prevent that contact that attendants would have, that they sort those materials more frequently, such as plastics, aluminum cans, steel cans, cardboard in some instances. And all of these changes, I've been assured, are temporary, but if anything changes, I am trying to keep constant contact with our local governments. Similar to North Carolina, our governor put in a stay-at-home order on April 7th, and by law, governor mandates last for 15 days. So he has to go in and make another mandate. And from that, our programs have seen massive amounts of not only trash volume, but also recyclables, yard waste, bulky items, electronics. Even in this time of year with spring cleaning, there's always an increase, but with everyone being at home at the same time, it's just twofold. And that is what I'm hearing from across the board. But everyone's keeping it up, fighting the good fight. So I really want to thank all of the local governments in South Carolina, and just, I really appreciate the job you guys are doing. So Mary, I think that's about it.
Perfect. Thank you so much. That is great. So we had a couple questions from the audience, and we do have time for maybe 2 or 3 questions for you guys right now. And I will be kicking questions to Sandy and Alex throughout the webinar that are related to things they need to answer. So, but one of the questions is actually specifically which communities have suspended recycling in the 2 states, and why did they make that decision, if you can shed light on that. And I'll start with Sandy, if you can speak specifically to that.
Yeah, specifically in North Carolina, we know that 2 communities in the southeast part of the state, Hope Mills and Lumberton, have temporarily suspended curbside recycling collection. And my understanding is that they were having a huge problem with contamination, trash being put into the recycling bin as an overflow. And so in an effort to prioritize getting the municipal solid waste picked up and appropriately dealt with, they've temporarily suspended the curbside recycling.
Okay, so it's not really related to the health and safety worries, but more just contamination for the MRF. So the problems we've been having for the last few years kind of exacerbating right now with more people at home, basically.
Mm-hmm.
Is that your sense of the communities in South Carolina, Alex, as to why they suspended, or is it different? And which communities have suspended in South Carolina?
So from my knowledge, it is the City of Orangeburg, City of Sumter, and Greater Greenville Sanitation, which services parts of Greenville County. They've suspended their curbside recycling. Specifically, City of Sumter suspended because their workers do hand sort at the curb. So that was a safety and health precaution on their part. The other two, I believe, is one because of not worker shortage, but just trying to keep that social distancing, and also in case a crew may get sick, they have another crew on backup. And then also just to focus on their trash pickup and not so much on their recycling.
Okay, all right. That's good to know. And then what is the most important thing that you guys would like to share with our attendees going forward as we work through this crazy pandemic? What is the most important thing that you would like our communities and our attendees at this webinar to take away from your perspective?
I can start just real quick. I'd say from our perspective, of course, we're talking about how important it is to continue recycling programs, but we know that the health and safety of the employees who are doing that work is first and foremost. So, we understand if there are situations that arise that necessitate, changes or temporary suspensions to the program. We've been in constant communication with our regulatory colleagues, and they are open to being reactive to the situation. So I would say keep your people safe and communicate with us if you need to make changes.
Great, thank you. And Alex, what say you?
I'll just piggyback on that because that is what I would offer to our governments as well. But also just if you do have changes, don't be afraid to tell me, please, because I would rather know. Just keep the communication open. And also, if you have changes and are sharing it with your residents, just make sure they know it's temporary and that this is all because of what is going on. We have gotten some questions, from residents, what's happening? Are they recycling this? Is it going to the landfill? And it's just important to make sure the communication is open as much as possible while still trying to have an effective program.
Very good. Well, thank you guys so much. We do need to move on, but if there are questions that have been left unanswered from the panelists, we can certainly try to touch on those at the end. And also, you have complete access to Sandy and Alex. They are working, so so you can reach out to them individually too, and we will share contact information after this webinar. So Marissa, we do not have a poll next, correct? We can go into the collection safety panel. I just want to make sure we didn't miss a poll.
No, you're good to go.
Okay, good, thank you. Okay, so let's get into it here. Okay, let's get into the safety aspects in light of COVID for solid waste collections. And again, we're focusing on recycling, waste diversion, but we can relate this to any aspect of collection. And so I'll remind you, to put your questions in the Q&A box as well as we go through this, and we will try to get to those. So on this panel, we have Bob Holden, Solid Waste Manager with the Town of Cary. We have Alex Miller, again with South Carolina DHEC. We have Tracy Nestor joining us from Republic Services. And we have Dr. Laura Merrill with James Madison University. And so starting with Bob, we're going to each of you go through and talk to us a little bit before we go into Q&A. So starting with Bob, I'd like you to talk about who you are, what you do normally, under normal circumstances, what you do day to day, what is your job like, and why you're joining us today, and how this pandemic has affected your operation, and anything else you'd like to share with us, of course. But Bob, you're up first, and tell us what's going on.
Okay, thank you, Mary. Well, I am the solid waste manager, as you can see, and it's day-to-day operations. We do collections of approximately 55,000 households. Cary has its own staff that does the collections, and we also have our own fleet and a set of fleet mechanics, which keep us rolling. We're really fortunate. We do all kinds. We have full service. We also have a convenience center for our citizens to use as well, which helped us with some of the decisions we made because of the pandemic. Cary was, when the pandemic started, Cary opened the EOC, Emergency Operations Center, which was a smart move on their part. It helped everybody work together, know what each division, departments are doing together, working together. We run social media through the EOC to make sure that the messaging is clear and concise. We have awesome citizens. So this was crazy for us, that how many people have loved to see the garbage trucks coming down the road, or the yard waste truck, or the recycling truck, and our staff has really felt the love of our fantastic citizens. Our leadership at the town, the management level, has kept us all abreast of what's going on throughout this whole pandemic. And it all began so we've been doing this for over a month now. March 17th was the first day that we really reduced forces. So it was only essential staff reporting to work, and essential staff being solid waste, yard waste, recycling. We also have some park attendants, and because parks never closed. We also had some people from operations, just in case there were sewer spills and stuff. We wanted to keep people on site. Let's see. Then we also we had some duplicates in positions that weren't necessarily like supervisors. So we rotate supervisors. We don't have all the supervisors coming in every week. We have them rotating, kind of helps keep social distancing and less people coming in, right? About April time frame, so 2 weeks in, the town, Cary, made the decision to put one person per vehicle to help with social distancing. We really focused on the health and safety of our employees and our coworkers. That created some challenges because we had to get vehicles for all these collectors that normally rode in the truck with their crew. We overcame that. Fortunately, Cary also has a pool vehicle system. We asked our customers that normally have backdoor service, which are like townhome communities, we asked them to bring their carts to the curb, and our citizens responded fantastically. They brought them no issues there. We had challenges of trying to find hand sanitizer for everybody. So we were using hand sanitizers, gloves, masks. We've been fortunate that people are donating masks. It's the support we've received from everybody has been fantastic. We also had to get radios for all these guys who are driving individual vehicles to and from the routes. We had to get them handheld radios so they could be in contact with their crew. We also are taking people's temperatures every morning when they come to work to make sure that we're keeping all of us safe. We also were able to get help. So normally we have crews of three collectors and a driver. And now we can only put 2 people on the riding steps, 1 on each side. And it was very challenging for some of the yard waste crews, especially. and we reached out to other divisions of public works, facilities, and operations, and our coworkers just stepped up. We had plenty of volunteers that have helped, that have been doing, guys that normally working in on a mechanic are now picking up yard waste with us. It's just fantastic. We have been doing special cleaning for our vehicles and offices. We also stopped special collections, curbside collections like bulky items, extra cardboard, things of that nature. But because we also have a Citizens Convenience Center, it gave our citizens an option to bring those materials and take care of them themselves, and we didn't have to. So it really hasn't really impacted them too much. We did see huge increases in our yard waste, and I think that's just because people are home and the weather's been real pretty. So that's a good thing, and I'm glad that was one of the things we thought, well, we may want to reduce yard waste so that we don't have so many people coming in, but it's a well-loved program. But that's about where I'm at right now.
That's awesome, Bob. Thank you so much. It sounds like you guys are doing a ton, and I know we're going to have some questions for you later on for sure. But we appreciate that local government perspective. And in contrast, we have Tracy Nestor with us, who may provide us sort of a different perspective from the corporate environment with Republic Services. Tracy, I wonder if you can let us know, who you are, what you do for Republic, and tell us what is, sorry, I'm going out of order, guys. Tell us what's going on with Republic right now, please.
Sure. Thanks, Mary. I just wanted to say that I wanted to say thank you for including the private sector in this dialogue. And my role with Republic is I'm the Senior Area Manager for Municipal Sales. Republic Services supports about 250 local government contracts between Baltimore and Savannah, and I oversee those contracts. Those are contracts for residential collection as well as convenience site collection and management, commercial collection, and industrial roll-off collection. So, to maybe add a little more context or color to what Bob had to say is just to say that, our world changed around March the 15th, and it's going to change forever. I can't see us really going back and modifying any of these safety implementations that we have implemented. I think that will be a norm moving forward. Our first responses were that we did, from a residential perspective, suspend yard waste and bulk so that we could focus on MSW and recycling collection. We have not had any of our customers in the Mid-Atlantic suspend recycling, so we're very grateful for that. But maybe I can speak to one of the reasons we've been able to do that is because all of our recycling is automated and cart contents only. So we can do that by servicing carts. We suspended those services, and then we started implementing our safety protocol, which would be that we're disinfecting trucks every night, and we are the drivers now are wearing masks and gloves. Our safety meetings are held with social distancing in mind, and we're having to stagger them. We would have safety meetings, every morning before the drivers would go out on the routes, and now we're having to stagger when those drivers are coming in to make sure that there's enough room in the area, or conduct them outside where everybody can be 6 feet apart. Our struggles when we were implementing these new safety protocols were we could not, there was a shortage of masks, and there was a shortage of hand sanitizer. I want to mention that one of the things that we started doing, even though we're a nationally branded company and we procure nationally, we started consulting with trying to get local vendors to fill those gaps. And I want to I don't know the name of it, and I wish I could recognize it, but they're particularly in Raleigh. We were able to reach out to some distilleries that were able to get a permit to manufacture a hand sanitizer. And in our Raleigh market, we just received a 50-gallon drum worth of hand sanitizer. So we should have enough hand sanitizer moving forward by contacting these local distilleries and utilizing them. Republic is also, from a driver perspective, we also have to consider retaining our drivers, right? Because drivers are a high commodity right now, and we want to retain them. And with the volume moving from the, from the businesses more to the curb, there's some drivers that have had reduced hours, and Republic is implementing programs to make sure that we retain our employees through this. And one of those programs is that we send food home with our drivers. We buy them a meal at work every week, and then we send a meal home to their family every week. One of the other things that we're doing is that we have been purchasing local gift cards in the amount of $100 to give to our drivers every other week, so that they're spending money with our customers and trying to keep that small business afloat. And like I said, and these things are going to continue, especially the safety, the social distancing, the sanitizing of the trucks every day, the emphasis for PPE and hand sanitizer will be a permanent part of Republic moving forward.
Thank you so much for that, Tracy. That is a great perspective, and I know there's going to be questions for you too, but let's move on. Alex, I know you touched on this a little bit, so you don't have to talk for long about this, but just briefly tell us a little bit about what you know about drop-off sites and what kind of safety measures they're seeming to take in your conversations you've had so far.
Yeah, so from what I've heard at the drop-off sites, programs are giving a lot of attention to the proper PPE, so masks, hand sanitizer, making sure that the attendants know to frequently hand wash. A common practice right now is asking the residents to not bring items that they can't lift themselves, so the attendants don't have to go and help the residents and be in direct contact or touch the materials that they're bringing in, so that we can protect our attendants. Also, I know in Pickens County, at least, they're asking their older attendants, 70 and older, to stay home out of their own safety and health. So that is a concern as well. I know one drop off in Anderson County, they had to close theirs because their attendant is a man of older age and of underlying health conditions. So what I'm seeing is our programs really are focusing on the health and safety of the attendants and making sure that they know all the proper protocol and all the CDC guidelines, and really pushing that.
Great, thank you so much for that. Now, next I would like to hear from Dr. Laura Merrill. Dr. Merrill, thanks for joining us today, and tell us a little bit about your experience. You have such a different experience than probably the rest of us, I'm guessing, and would love to hear your perspective and how you got roped into this.
Hi, thank you, Mary. Yes, I do have a much different perspective. So I am an assistant professor at the James Madison University, and I teach in the Department of Health Sciences. And currently I teach senior students the class of epidemiology, which probably none of you had heard of that prior to this experience. And so in late January and early February, I was teaching my students about disease outbreak investigation and epidemics and pandemics. And unfortunately, we're in a situation where we're all having to learn about that now. In addition to that, I also teach health communication. So how do we communicate to the public, on a public health level about issues of health and what are the best practices there? And of course, I also do scientific research. And so how I got roped into this, well, Mary and I are college best friends, and I was thinking about it before this webcast started, and we've known each other for 20 years now. So she reached out to me because she was really looking for somebody who could maybe answer some of those questions about the health side of things. And so what I would like my role to be is you've probably been hearing a lot of information through, your state health departments, through popular media. And I've really tried to go and look at, the science and the data that those recommendations are based on. So when it comes to, social distancing and hand washing and PPE, looking at the data, looking at, how long the virus will survive on different surface types, and trying to contextualize that science for you and your employees and the public at large. So, I'm really gratified to hear that you are all already talking about, health and safety procedures and risk mitigation efforts that, I would have told you to start with, but you're already thinking about those things. So I'll kind of end there unless there are specific questions that people have.
Thank you so much, Dr. Merrill. I don't know what I'm supposed to call you since we've known each other so long, but thank you so much for that. And we appreciate the time and the research you're helping us with on this. There's really a decided lack of kind of resources in our industry that can relate these things. So I told Laura before we did this, I said, your number one concern about participating in this is that you'll probably get invited to a bunch more webinars. So apologize in advance for that. But one of the things that I want to talk about is, there's a ton of information out there that we're trying to synthesize, and some of it is conflicting about the spread and the best safety measures for Corona. At first the prevailing recommendations really changed a lot from day to day. They changed more than a baby's diaper, honestly. But now things seem to be settling down a bit, and I'm wondering for our for our panelists, for Bob and for Tracy and for Alex, where are you all getting your information from, and how are you processing that with so much out there to digest? And I'll start with you, Bob.
Oh, thank you. We're really fortunate. Again, like I said, the town opened up its own EOC, and we have specialists that in the logistics group that help us and make a lot of those decisions on what's the best safety practices and trying to keep everybody safe.
Mm-hmm. Yeah, and so you kind of have staff people that are devoted to that, and they're getting their information from hopefully reliable sources. Tracy, tell us about you guys and where you feel like you're getting your information from, as far as what are the best, what are the risks and what are the best ways to protect ourselves.
Our company has started mandating a daily call that we have. So we have an area call every morning that runs from about 8:30 to 10 a.m. And that is to receive actually updates from each one of our BUs on if they have any positive tests and what they're seeing in their market. Above that, our corporate headquarters in Phoenix is very well connected with, I guess, at the right levels with CDC, and some universities where they're receiving the information. and then they're pushing that out to us. So
Gotcha.
I would just say that we're just getting it from our headquarters.
I gotcha. And Dr. Merrill, tell us, in your view, what is the best or most reliable place, for us to get information, if we don't have some of these experts on our staffs, or like in the case of, the local governments that Alex is talking about with their drop-off sites, that may be operating autonomously and may want to know where they can get the best information about how to protect ourselves from COVID-19 in our jobs.
So the best place and most reliable place to get information would be the Centers for Disease Control and Prevention. And from there, the state health departments. And state health departments are talking regularly and consistently with the CDC about, what the proper sort of the risk mitigation efforts should be. Thankfully, the best things that we can do right now are the things that you've been hearing about, and thankfully they're not unique, and that those are social distancing as best you can. And of course, there are limitations given how your collections or how your how your operations work, but certainly you and your employees will have the best ideas about how to do that and how to sort of continue your functions in your communities. Hygiene practices, including hand washing often. Now, of course, I know that, if you have attendants or employees on a truck, that makes it difficult because you need soap and water. You can use hand sanitizer, but I think as Tracy pointed out, it may be difficult to come by. And using disinfectant. If you can't get wipes, then you can make effective at-home disinfectant. And then utilizing risk mitigation efforts in terms of the personal protective equipment. Which types of equipment are better than others if you don't have access to sort of like N95 masks? Should you be wearing gloves? Should you be wearing glasses? What do you do with your clothing that you've worked all day, on a truck or out in the public? So I think the best resources are definitely the CDC, and using, common sense when it comes to what we know about how viruses and germs can pass from person to person.
Awesome. Okay, thank you so much. Now, we only have a few minutes left on this panel. So one thing that I really want y'all to talk about is the communication between inter-office communication with employees, and then follow that up with communication to the public about what you're doing. But first, let's talk about inter-office communication as far as PPE, COVID, and what's working, what's not working. What are you doing to create an open communication environment? And I will start with Tracy.
As I mentioned, we're having daily calls so that there's no surprises. From an employee perspective, if an employee, we've encouraged them to be very open and honest and be able to discuss if they don't feel well. We don't want people coming to work that don't feel well. So one of the other things that we've offered is that there are any medical, we've offered them, and if they are diagnosed with COVID, they get an additional 10 days of vacation, and then we're also paying for any health care related costs that they may have for COVID. Wow. So so that's the communication that we've gotten out to our employees. If they come to us with a presumed positive, they're automatically quarantined for 14 days. Until they get a doctor's note that says that they could come back. So we tell them to go home for 14 days and prove to us that that you're not sick if you want to come back before then. And we've had
Mhm.
quite a few of those. We
Wow.
have had, I think we have 3 positive cases in the Mid-Atlantic area. None that I'm aware of in North Carolina or South Carolina within our group. But the 2 that we've had were in 2 were in Charlottesville, Virginia, and then we've had another one in our Frederick, Maryland office. So we've had 3, and basically we've not had any bad news from any of those. And we even have one that had tested positive and has been through the 14-day quarantine and has had the doctor's release and is coming back to work. So just to kind of maybe sum that up to your question is being very transparent and trying to take any pressure over them not being able to or being concerned about letting us know whether they feel good and whether they're sick, and trying to overcome any financial burden that this event has put on them.
That is phenomenal. That is wonderful to hear. And Bob, tell us a little bit about what you guys are doing in terms of communication with employees, and what do you do if someone's feeling sick? How are you addressing that?
Very similar to what Tracy was saying. When people call in sick, they don't feel well, we ask them to go to the doctors, and they have to go to the doctors or the virtual doctor and get cleared, because we don't want others to get sick.
Mm-hmm.
And we're trying to protect everybody. As far as communications, we get daily communications through the EOC and the town manager, because we're in this together, and it's been a very strong community approach to making sure that each member of our staff has access to information. HR, our Human Resources Department, has opened up phone lines, so not everybody has a smartphone or computer, and they opened up a phone line so that people that don't have that access can call in and find out what's going on, what they need to do, what's the status with the town and different jobs.
Yeah. Mm-hmm.
It's just been pretty amazing that the supervisors, we talk to employees every day. For the solid waste staff that come in every day, I mean, we're always sharing new information with them, posting any different updates that they need to be aware of, and monitoring people's morale. And it's been phenomenal, people's morale around here. I've never experienced the camaraderie and caring for each other. So that's the other thing. People look out for each other, and they make sure that they keep their social distancing and make sure that they're wearing the mask and they're washing their hands and all that. So it's self-monitoring plus each other, looking out for each other.
Sounds very supportive. Now, Laura, hearing this, what is your sense? Is this what we're talking about in these 2 examples? Is this going to improve health outcomes significantly? And is there anything else you would advise in terms of inter-office or inter-employee communication?
I think y'all are doing great. Y'all are doing the things that you really should be doing, from what I know from a health communication standpoint. When we have open, honest, clear communication at the different levels, that makes sure it assures that everybody knows what they're supposed to be doing. If you're communicating with employees and letting them know what you know, as soon as you do, you have a reciprocal relationship where they're going to do the same for you, hopefully. Also, talking to employees and telling them, hey, wanting to know if you're sick or if, something changes with your family is never meant to be punitive. It's only so that we can keep you healthy and safe, and that we can keep your coworkers healthy and safe. I know that a lot of people now are sort of worried about job security, and they might be worried that, well, I do have a little bit of a cough, but what if it's only allergies? And so they may be hesitant or reticent to talk openly with their employers. But if the employers are doing the things that y'all are doing, I think that you're really creating this environment of having open, honest, clear communication so that everybody knows what we're doing, why we're doing it, and that it's all so that we can keep, our people who are our greatest resource, keep them safe and healthy.
Now, Laura, we talked about this a little bit, last week or the week before about communicating with employees about what to do at home to stay safe and to prevent spreading, germs from work to home and from home to work. So can you talk about that just briefly? We're running over a bit on this panel, but I do want you to touch on home communication and how important that is.
Yeah, so it's very important that the employees know that they also need to be aware of what's going on in their family unit. So if their spouses or their children are exiting the house daily and coming into contact with other people, that's potentially putting them at risk and anybody that they come in contact with. If I think, we talked a lot about sort of what do you do? Like, yes, you're doing your social distancing at home, or at work, and you're washing your hands at work and maybe using hand sanitizer. Well, what do you do when you get home? And I think they need to be taking off their shoes outside at the door in the garage, and taking off their work clothes, and those should be going straight into the wash. That they shouldn't be wearing the same set of work clothes without washing every single day, and that they then, once they get home, they go straight to a shower and take a shower. And that's the best way to make sure that they're keeping their home safe, and that their work clothes, like when they get ready to come into work, that those are sort of the last thing they put on before heading out the house. And of course, putting on the shoes, maybe outside of the house. So those are easy to do, I think, for most families. That doesn't take a lot of time, effort, or money to be able to do. So I think that's what you were referring to.
Yes, exactly. Thank you so much for touching on that. So as you guys can see, we have a poll going because we're running over. We went ahead and showed you the poll, and you can see kind of what some of the safety concerns that folks that are on the call have, which I think we're at almost 100 participants on the call now, if I'm not mistaken. So, this is coming in. We're concerned about going back to work too soon before this is over. We're concerned about just keeping people as safe as possible. So we'll try to touch on some of these concerns at the end if we have time. But we now need to move on to our MRF panel. So I want to thank you, panelists, and you're not off the hook yet, but you can go ahead and mute, except for you, Laura. We're going to work you pretty hard on this one, I think. But I want us to go ahead and move on to our MRF safety panel. So, we wanted to include MRF safety because, it's extremely important that we not only have safety at the curb, but that we know that where our materials are going, that we're not participating in making someone else less safe. So even though, maybe most of the people on the call may not be in the MRF environment, it's really important that we understand what they are going through, because that is going to affect collections. And so, so that's why we really needed to include this panel in particular. So, so I will start with Joe. Joe is the engineering and compliance manager for Mecklenburg County, and they have a very large county-wide material recovery facility there in Charlotte. Joe, if you would introduce yourself and tell us how this has affected your operations. I'm sorry, I did out of order again, but go ahead, Joe. Joe, do we have you? Okay.
Sorry about that. I had to grab my mouse and unmute me. But my name is Joe Hack. I work with Mecklenburg County. We're a metropolitan area of roughly 1 million people. The largest city has more than 200,000 houses, and we serve roughly 450,000 residential dwelling units. And among the other options is we operate a material recovery facility. And the safety of the employees is very important to us. And one of the big things is we're communicating a recycle right message, is, put the right things into the right containers. Because one of the things we'll be talking about is we are seeing an excess in contamination. Our MRF that normally receives about 300 tons to 350 tons a day is averaging almost 400 tons a day. And even this morning we had more than 1,000 tons on the floor. So our concern as a MRF operator is, like I said, the safety. What we've done in the MRF is the employee break room. We have expanded into the educational area. We have stopped educational presentations and now allow the employees to use the education area for breaks. One of the other items is the plant manager is sending us daily health updates. We cannot run the plant without people. So we're monitoring the health of the people in the plant. And, so we're communicating actively with them. We have also pushing out public service messages to the community to remind them to recycle right and to put the right things into the right container. Example messages like, if your house is impacted, bag your recyclables and put it out with the trash. So we are continuing to monitor that. The other thing is a planning entity is we're also trying to evaluate what happens if the MRF, something happens to the MRF and we can't process materials. So on that side, we're looking at downstream markets, we're looking at market conditions, we're actually having discussions with DEQ about what happens if we have to landfill our materials if we have no place to process them. The other issue that you'll hear about is contamination. One of our challenges is we have 4 full-service drop centers as well. We have seen more than a doubling of customer counts coming into our drop centers. The sheer volume is impacting the safety as we go. So it is a very large operational challenge. We lost 2 hours of processing the other day because of a brake pad that someone thought was recyclables jammed the glass screen. So it is an ongoing challenge, and once you get it out of the trucks, it comes to the facility, and how quickly can we process it? Much like the others, we have hand sanitizer. The operational practices in the MRF for health and safety aren't similar. They've always been. Respiratory protection is available. Gloves and social distancing are the big ones on that one. Biggest thing that's hurting us right now is wishful recycling, is people putting the wrong things into the container, the overflow of trash, the trash coming in. Residue, haven't seen the numbers, but I would not be surprised to see it drifting a good bit above 20% for this month.
Wow. Thank you for sharing that, Joe. And Patrick, let's hear from you from the Sonoco perspective. So Patrick McDonald is the Raleigh plant manager for Sonoco Recycling. Big company, lots of impact, lots of customers in the Carolinas, north and south. So Patrick, give us, tell us a little bit about what's going on with you and with Sonoco right now.
Yes, thank you, Mary, and thank you by all means for including MRFs in this discussion as well. So just a real quick background on our MRF in Raleigh. We're processing between 9,000 and 10,000 tons per month of residential commingled. We've got about 90 people working at our Raleigh MRF across 2 different shifts, so it's a significant operation for us. And we felt this would be a good opportunity today just to share best practices in terms of how we're dealing with these challenges along with our peer group, really as a way to continue to ensure the viability of these operations during this time, because it's basically that's what it's coming down to is ensuring that all of our workers remain vigilant against the risks. So in terms of some of the specifics around what we've done, similar to what others have mentioned and what Joe spoke about in Mecklenburg, the same social distancing, increased hand washing and sanitizers. Where that can get a little difficult is there are a couple of sort positions in our MRF just owing to the configuration, the layout of the process flow and conveyor belts, that we've had to modify a couple of positions where we could not provide that 6-foot buffer. So we have made a couple operational modifications, nothing major. Similar to what Mecklenburg is doing, we're obviously no longer doing tours at this point, so we've got a nice big education center on our 2nd floor, so we've converted that to an overflow break room and lunch area so we can continue to provide more distance for our employees. And on that, we've got very strict protocols around PPE. So PPE cannot come into the office, the break room, the lunch area, the restrooms. It's got to remain out in the plant. And we've also enacted sanitation stations for our PPE. Mostly, the biggest impact there is gloves. So we're, you know, a MRF sorter has an array of gloves that they wear on a normal basis. They've got kind of an interior glove, then they have an external glove that provides protection against sharps, needles, and the like. So we're increasing the sanitation of those gloves. And as I said, just beyond that, we've got a person who's dedicated going around wiping down common touch points, door handles, light switches, things like that. But I did want to mention it's not directly related to COVID, but I think, you know, we would all acknowledge our industry, whether it's on the collection side or the processing side at a MRF, can be an inherently dangerous undertaking, right? There's a lot of risk. So we've been very careful and adamant to stress to our folks that all of the safety risks that existed in January prior to COVID, be it things like lockout, tagout, and energy isolation or pedestrian safety, all of those risks are still out there. They may get kind of lost in the noise with all of the action around COVID, which is appropriate, but we've been very adamant to stress that those other risks remain out there as well. So we have to keep our mind on task with mitigating and managing through those risks the way we normally would.
Yes, anyone who's worked in a MRF environment knows that MRFs and MRF workers are no strangers to dangers. It's so unpredictable of what comes in, but this is something like, you know, we've never seen before. So a couple questions specifically about your contamination that you're seeing. What is there a trend on the contamination that you both are seeing in coming into the MRFs? Is it bagged recycling, or is it just the bad recyclers just doing more bad recycling? What do you think it is? And I think this question will help us figure out how to address, you know, education needs in our communities. So go ahead, Patrick.
At this point, we haven't, there's a seasonal variation in some of the contamination numbers anyway, because people's practices are different in, say, April than what they would be in February or September. So we're trying not to read too much into the numbers. Once we have full month numbers, it will be a little bit easier to crunch that data to look for trends. Just anecdotally out on the lines and just looking at some of the volume of our outbound residue, I haven't seen anything too perceptible at this point, but we're certainly keeping an eye out for all sorts of trends, just because there's been such a big shift in patterns and consumer patterns and household patterns, just daily life. So, you know, one thought is initially our suspicion was that we would see a spike in our commingled material across all grades, but we haven't quite seen that yet. And if you consider the fact that many of our municipal and county suppliers are on a 2-week collection cycle, it very well may be the case that we're not getting all of the recycling that we used to, because people are filling the bins up faster. And if they're doing that, maybe that recycling is making its way into the MSW bin, or maybe it's being put in their, you know, pickup truck and brought to the county convenience center. So long-winded answer, I don't really have any clear data on the contamination rates at this point, above and beyond. You know, it's not necessarily a rosy picture in the best of times when we're, you know, in the high teens, sometimes as much as 20%. So it's my sincere hope that represents the ceiling of contamination percentage, but as of yet, I have not seen any clear data on that.
Okay, thank you. And Joe, what about you? Tell us if you have any more insights on this.
Well, It's really a whole series of things, and running through there, all of the Goodwills near our drop centers have closed. So things that people wanted to give away at Goodwill are showing up in our recycling bins. So you have a lot of cloth fiber products. Other impact we're having is we've seen an increase of yard waste coming in. We had 2 municipalities, Charlotte and Matthews, that made decisions to postpone yard waste collection, and people still wanted to recycle it. In fact, I mentioned earlier, we approached the state about relaxation on the commingled bottles and cans going to the landfill. We're also talking with the state about possibly getting some yard waste into the landfill. Some other things we're seeing, as you mentioned, the plastic bags. People bag their plastic bags. It wraps around all the rotating shaft equipment. We do not open bags. We just throw them away for employee safety reasons. The other thing that's really impacting us is scrap steel items, brake pads, car parts, things that if you go to our website, it says we take scrap metal, but only at our drop centers. These are things that rip the conveyor belts apart. They block the screens. So it's really a whole series of contaminants that are increasing as people are staying at home. And it's just, I would say right now the biggest thing are the Goodwill items, the plastic bags, and the yard waste. And every once in a while, the metal item that tears a conveyor belt apart.
Very interesting. Very interesting. So at this point, we have about 20 more minutes. So I want to just kind of open it up to all of the panelists now. And I don't think we have a slide with every panelist on it. We probably should have. But I want to open up to everyone for the Q&A coming in for the audiences in the last little bit of this. And so I do have a health question for Laura regarding the risk of contracting, COVID from a surface. So I think this is a big question that is sort of seems unresolved as far as, when we're handling items from a household, whether it's at the MRF or at the curb, we're primarily worrying about the spread of the virus in our respiratory system. But what I think, so tell me, am I thinking right? Should we be, how worried should we be about surfaces and keeping in mind the types of surfaces that we would come in contact with, plastic that has come in contact with saliva, or God knows what else, but hopefully just saliva and, other exposure that we have. What is your sense of our biggest risks there, or maybe it's not as risky as we think with surfaces?
So the biggest risk for COVID transmission is actually person to person. So being around somebody, sort of being within that 6-foot social distance, and talking, and somebody either being asymptomatic or low symptomatic, such that they don't even recognize that they have symptoms, and having viral particles being aerosolized in our spit. So that's where most people are coming into contact with the virus. Is it possible that virus can be transmitted to surfaces and then transmitted to another person that way? Yes, it is. It is, however, low risk. I don't want to say it's no risk. There's been several studies that have come out in the last 2 weeks or so, preliminary studies about how long virus can live on certain surfaces. And I'm sure a lot of you have heard about cardboard, it can live for 24 hours, plastics for 2 to 3 days, metal for 2 to 3 days, and glass for 4 days. I want to contextualize that study, and that they're looking at how long virus particles possibly can live on those surfaces. And most virus will die anywhere from between 10 minutes and 2 hours. That's where the biggest risk is. So, very little virus is going to remain on surfaces beyond that time. That's not to say that no virus can live on those surfaces. Surfaces that are flat and are harder will hold the virus longer than sort of rougher, sort of other surfaces. So that's why glass and plastic, you know, we see the maximum time that the virus can live on those surfaces be much longer than you know, other sorts of materials. So that's where sort of the research is right now. But you've probably heard all that, and I just kind of want to contextualize that they're talking about the absolute maximums and not the, you know, the average time that large amounts of virus will remain active on any surface. So, you know, the biggest risk is just being around people. That's why I'm like, yes, y'all are doing the right thing by social distancing. But that's not to say that there's no risk when it comes to the surfaces that your people are coming into contact. You know, I'm actually more concerned with the public who are coming in to contact with employees, maybe dropping off materials at the different processing sites, you know, whether or not, you know, they're coming in masked up and having already pre-sorted their materials, so they're spending only the time that they need to in, you know, in the recycling center or at the drop site. Where I live in Harrisonburg, they're only allowing, there's no recycling pickup from curbside. You have to take your recyclables either to the processing plant or to a drop site. And so I went to take my recyclables last Saturday, and there weren't any signs about people, you know, maintaining social distancing. And you know, I was trying to dodge people right and left who were trying to come up next to me and recycle their own material. So that's where I would see the greatest sort of risk for your employees. And I'm happy to answer any other follow-up questions about that.
Awesome. I think that what you just said is extremely comforting. I hope everybody feels that way too. But we do have questions about drop site safety in particular. And so, you know, since we're open to the whole panel and we have a good amount of people that do both collection and drop off sites, tell those of you who are operating drop sites or have knowledge of them, tell us, you know, how you're mitigating that specific risk now that we know it's more likely to spread from person to person through droplets. And Laura, I'll ask you next to talk a little bit about droplets versus airborne, and just so we have a little bit of information on that. But first, let me kick that to Alex Miller regarding drop sites. So I know you touched on this a bit, but how are the drop sites you know of keeping that a really good level of social distance when also trying to monitor what's being dropped off?
Yeah, so we have a few examples, such as Anderson County, who has temporarily suspended some of the materials that are frequently sorted by the attendants for their health and safety. Also, just making sure that the attendants know about all the proper protocol. I know Greenville County, they have, they've gone over kind of like not a contract per se, but just signed a form saying that they know about the proper protocol. They will do their best to abide by it all. So really making sure that it's in their heads and that they're taking this seriously for their own safety and their family safety, but also for the residents' safety. So I hope that answers your question. But I guess just making sure that the attendants know the seriousness of the situation and, you know, are doing the best that they can.
Yeah. Okay, great. Does any other panelists want to weigh in on this? I'll wait just a couple seconds if anyone else wants to pipe in on that.
This is Joe. I can weigh in on it.
Go ahead.
The drop centers have been a challenge. With us being essential business and everybody staying at home, everybody's coming to visit us right now. We've had sites that were, doing a couple hundred tickets a day that are now processing 1,000 or more customers a day. And some things that we've put in place is on the fee collection side, we stopped taking cash, we closed the windows, we put in microphone systems, we're only taking credit cards. So we're trying to isolate the fee collectors from contact with customers. On the staff, we're having to hire security guards and bring additional staff in just to direct traffic. Because as you imagine, when people wait in line, tempers get a little hot. Some of the other challenges is, and while we have staff on the ground, is maintaining social distancing, is we're having people who have never visited our sites before who don't know where to go when they get there. And so it's been a constant re-education of trying to keep the sites open, especially when we're supposed to be staying at home and no one at the drop centers appears to be.
Okay, thanks for weighing in on that. Does anybody else have a comment?
Hey, Mary, this is Alex. Can I just add on to that?
Sure.
Yeah, so we are also seeing that. Obviously, some programs, I don't want to say have better customers, but more understanding customers than others. And for example, in Greenville County, they have also added some more temporary employees to kind of direct traffic. They've added signage. But not all programs can do that. So it really is just an education for kind of new customers for them as well.
Yes, and Bob, I know you wanted to weigh in as well. Go ahead, Bob.
I sure did. Thank you. In Cary, we posted signs, a special social distancing sign, and we also did social media guidelines for using the convenience center, such as maintaining your 6 feet of distance, being responsible for unloading your own vehicle. And we also, we charged fees for certain items that came in, and we eliminated the fees right now. So temporary stop collecting fees, again, just to lessen these social interactions with people. But it is challenging to try to, as Joe was saying, when you have new people coming into the community center that aren't regulars, they don't know where to go and they don't know the process and the procedures, and it does get challenging.
It certainly does. And, Laura, one more question for you, just kind of a medical biology question, whatever. How effective, are the masks that we're using in terms of preventing the spread and the contraction of COVID? Are the masks an effective way really to prevent, inhaling or in your respiratory system the virus in these situations where you're outdoors in a collection center, for example, or anywhere, if you're indoors, whatever, it doesn't matter. But how effective do you feel that is?
I do think it's effective. I've been looking at recent studies that have been published, and because this is a person-to-person droplet transmission, the vast majority of virus is really going to come from somebody's mouth or their nose. And so if we can cover that, we're really going to prevent it, being transmitted to a wider field. Probably all of you know that the N95 and surgical masks do the best job in terms of preventing that. But those are being reserved for healthcare frontline workers. And I will say that they are at the greatest risk for infection given their jobs. So recent studies have shown that even homemade masks can offer significant protection, though they offer less protection than medical grade masks. So, some mask is better than no mask. And this is sort of the hierarchy of homemade masks is that, if you can make a mask out of a HEPA filter, that's best. Then using just regular homemade bed sheets that are between 80 and 120 counts, using canvas that is between 0.4 and 0.5 millimeters thick. Then the use of shop towels is sort of the next best. And then sort of finally, the would be 100% cotton that most of us are making homemade masks with, sort of layered up. And that would be sort of my final level of materials that I think that have been shown in some recent scientific studies to work the best. All masks need to be worn properly in order for them to be effective. So they need to cover both the mouth and the nose, and they need to be as tight to the face as you can get them, while still allowing you to breathe like you should be. And it should be noted that masks should not replace social distancing, and that using masks with social distancing is going to be the most effective way to prevent the spread. And the reason why masks are important is there's varying data that suggests that between 50 to 80% of people who are infected with COVID-19 are what we call asymptomatic or low symptomatic. So either they just never have symptoms, they never feel sick, or their symptoms are so mild that they don't recognize that they might be infected. And if they're not wearing masks, then potentially they're putting other people at risk. So that's the importance of wearing PPE and glasses as well. So all of your folks who are wearing protective glassware in your facilities, those are also protecting them from COVID infection as well.
Great, thank you for running through that. I know we all have a lot of questions about that, and you know, we're approaching the end here, and we cannot go over our time. So, gosh, so much we have learned. At least I feel we've heard so much good information here. We have a poll up right now. What's the biggest takeaway for you from this webinar? So please do fill that out as we wrap up. One final question for all of our panelists. What is something positive that you feel has come out of this situation? I'm going to start with Patrick. In your assessment, give us something positive real quick, because we have very little time.
Yeah, I would just say quickly, our staff really feel valued. You know, it's something to be called essential, and you know, I think they look at their work a little bit differently than they used to. And you know, speaking personally, coming here every day, if you know, if nothing else, it's a distraction. So I'd rather be focused on tons per hour and uptime than you know, mortality rates from a pandemic. So you know, work can be a nice distraction at times. But bottom line, I think our staff are glad to feel valued and essential.
Wonderful. And Joe, real quick, a couple seconds. We don't have too much time left.
I'd like to reiterate, it's the frontline staffing. We could not do this without the dedication of the frontline employees who are interacting with the customers every day, the people running the plants every day. The rest of us behind the scenes, we plan and make things happen, but we cannot do it without them. And their dedication and enthusiasm to put up with the long extended hours is admirable. And so that would be the biggest takeaway for me.
Great. And Bob, real quick, share with us your positive takeaway.
I would say that our communication amongst each other has improved. The employees, our coworkers, they are feeling loved by our citizens, and the camaraderie of the guys and girls, the men and women, working together.
Definitely. And Tracy, your words of positivity at the end of this. Do we still have you, Tracy? We may have lost Tracy. Let's go to Alex real quick, if you can.
Yeah, I would just like to piggyback on the employees. I'm really grateful for our local governments and their constant communication with me, and just their openness to, you know, tell me the info. So I'm really grateful for all of them.
That's great. Thank you so much. And Laura, I'm sure that you're seeing some positives here too in the way that our nation is reacting. Can you share a quick, very, very quick word on that?
Well, I've been gratified that now people know that public health is so important. So my and I feel good about that. But that, you know, those of us in public health have said it's a part of everything. It's even a part of recycling and waste management. And so I think that that's really important to know now that, you know, all of our systems are connected and we need each other. We need to communicate to each other.
Absolutely. Thank you so much. All right, we have just a few seconds left. So we have a final poll that's going on. Please fill this out. What recycling topics would you like to see covered in the future, in the near future, by this webinar series? Please fill that out. You can keep filling it out even when the webinar is over. I want to thank our panelists, our wonderful partners. I want to thank RRS for your partnership as we look at these poll results until we get cut off by the webinar timer. You know, we want to continue offering this series, and we just appreciate your time and expertise so much. This webinar will be available, this recording will be available online very soon. And if there are any additional questions, you can contact us anytime, and we will try to connect you with any panelists that you have questions for and get the answers that you need. So everyone, be safe, be well, keep filling out the poll, but be safe and be well. We miss you, and we will talk to you again very soon. Thank you so much again, and everyone have a great day.